Good morning.
Good morning. Good morning.
Thanks for coming. My name is Joe Piet. I'm a retired postal worker and still a union member with the National Association of Letter Carriers. As a member of the International Action Center in Philadelphia, I'd like to thank everyone for joining us here today. There are about 170 million people chronically infected with the HEP-C virus in the world today. The Asia-Pacific region bears the highest burden, but without access to affordable treatment, between 350,000 to 500,000 people die of liver disease caused by HCV every year. Like in the rest of the world, in the U.S., this silent epidemic has a disproportionate impact on impoverished communities and people of color. While African Americans comprise about 13% of the U.S. population, they represent 25% of all HEP-C cases. For Black Americans aged 45 to 65, HEP-C-related chronic liver disease is the leading cause of death. Up to 43% of all people infected with HEP-C pass through a correctional facility. That's one of the reasons why prisoners in Kentucky, Minnesota, Massachusetts, and other states have initiated lawsuits demanding access to HEP-C medicine. Illinois and New York are among the few states that provide some access to HCV treatment. We are here today about the 10,000 men and women, including Mumia Abu-Jamal, being held in Pennsylvania's prisons who have HCV. Mumia is a political prisoner falsely accused in the 1981 death of a Philadelphia cop. He was sentenced to death, but a people's movement led by many of the people in this room were able to get him off death row. Even though he should be free, he is being forced to serve a life sentence in prison instead. In other words, it's still a death sentence, just slower. Speakers tonight will describe his health status, which, if not treated, will lead to his premature death, a death sentence by medical neglect. A month ago, during a conference call meeting with Pennsylvania State Representative Vanessa Brown, we learned that the Department of Corrections lacked any protocols, a standard set of rules, for testing and treating prisoners exhibiting symptoms of HCV. The DOC, however, was in the process of writing protocols, and we saw this as an opportunity, a window of opportunity, for concerned people to pressure the state to come up with strong rules mandating the best treatment for HCV-infected prisoners. The labor group within the group I'm in, the IAC and Workers' World, represented today by Johnny Stevens, who's behind the mic. He should be here.
Where is he?
He's behind that camera there. Sue Davis and myself, we came up with the idea of a campaign appealing to healthcare providers. It demands that the governor, the Department of Health, and the Department of Corrections in Pennsylvania come up with a good plan to treat not only Mumia Abu-Jamal, but all prisoners as needed with the new HCV drugs that have proven effective in over 90% of cases. In coalition with the International Concerned Family and Friends of Mumia Abu-Jamal and the Free Mumia Abu-Jamal Coalition of New York City, over 70 healthcare providers signed that appeal. And we have some on the table back there. It's in the press packet. We followed that up with an online petition that anyone could sign, and over 750 of those signed petitions have been sent to state officials in Pennsylvania. Today's event is the next step in continuing the campaign to put pressure on Pennsylvania officials to do the right thing. Thank you.
Our first speaker, who
is the one who has arranged for us to have this press conference at 1199, the foremost healthcare union in New York City. Oh, I should mention, I'm a member of the National Writers Union, the United Auto Workers, 1981, and I am the sponsor of a resolution that was passed unanimously by my union to demand immediate treatment for Mumia Abu-Jamal, and I must admit that I think that helped kickstart this whole campaign. So I'm very pleased about that. But it also reinforces the union connection because Mumia has been an honorary member of the National Writers Union since 1995. So now I have the great pleasure of introducing Estela Vasquez, Executive Vice President of Local 1199 SEIU, United Healthcare Workers East. Estela.
Good morning, buenos días, and welcome to 1199. Our house is your house. In this union, we pride ourselves of our long history since this union was founded in 1932, of aligning ourselves with progressive justice, progressive struggles, whether it was the civil rights movement in the 1960s, the anti-war movement, solidarity with Cuba, but most important, for over 25 years, 1199 has been in full support of the freedom for Mumia Abu-Jamal, and I proudly can say today that we continue that tradition of saying, free Mumia, free Mumia. We are here today to join our voices to the people here sitting at the table at this press conference, and at the same time with many other healthcare workers around the country that have called on the Pennsylvania prison authorities and the governor and other authorities in the state of Pennsylvania to demand that the criminal neglect of Mumia stops immediately. We call on everyone in this city. We call on our members to join our voices to denounce what the state of Pennsylvania is doing. The same way that years ago in the early 90s, the outcry of the world was able to free Nelson Mandela from the jails. We're going to continue that outcry and demand freedom for Mumia, but most important, we now demand humane medical treatment for Mumia. Stop the assassination by medical neglect. Mumia must receive medical care. Thank you.
Let's welcome Pam African.
On the move, family. Okay, I just come off a tour from the West Coast on behalf of Mumia and the medical condition, and the fact that, you know, we not only need to deal with the medical, but the fact that Mumia is innocent and he should be brought home so that we can take care of him. And some of the best doctors have stepped forward. Brother Bob Harris, who is a former Panther, which you'll be hearing from a little bit later. The tour that I was on was to bring visibility, and because we have a great worldwide internet, email, Twitter, system set up for Mumia, but what we also need to do is have street visibility, because this government is shaking from what it is that they know. But people on the outside who is not on the internet, who doesn't do emails, also need to know, and the numbers that we have. So that's what we're stepping up, high visibility on behalf of Mumia. And I'm not going to take long, because we have people who have a lot of good information, to get Mumia great medical help. One of the things that we found out from State Representative Vanessa Brown, that there is, at this point, one person in the state of Pennsylvania that is now getting hepatitis C treatment. So with that, we're hoping that soon Mumia will get it. So we got to keep the pressure on the electronic means and in the streets, up in their face. Thank you.
And now I have the pleasure of introducing Suzanne Ross. She's co-chair of the Free Mumia Abu-Jamal Coalition in New York City, and she's going to summarize points from a 10-page statement produced by Dr. Joseph Harris, who is the head of Mumia's medical team and an expert on HEP-C. Suzanne.
Thank you, Sue, and greetings to everybody. I'm going to try to summarize not only what Dr. Joseph Harris said, but also Mumia's own affidavit on what happened to him. As part of the legal papers that the lawyers filed, they had an affidavit from Joseph Harris as the medical expert and from Mumia describing what he went through. But first, I want to say a little bit about the context. Again, we have to say every single time we speak about this that the state of Pennsylvania and whoever else in this country and behind the scenes, over the scenes, or whatever, who have been trying to make sure that Mumia was silenced and dead for years and years and years, tried every trick possible, including, as you all know, the outrageous trial that was hardly a trial, and then finally getting him, being forced to have him removed from death row and brought into population, then has been forced to figure out Plan C or Plan D or whatever. You know how many times they tried to kill Fidel Castro? Well, they're not going to succeed in killing Mumia. They're not going to succeed in killing Mumia, and we're going to make sure that he gets the medical care he deserves and ultimately is freed. So that's the context. So the history of the medical treatment that Mumia has gotten, treatment in quotes, over the past year is shocking in the sense, only if you are used to this and take it for granted that this is how the Department of Corrections treats people, would you not be shocked. Anybody who does not understand the system would look and say, this can't be happening in the United States. Isn't there someone you can go complain about this to? People often say this to me. Isn't there someone you can appeal to? So it's a history of ignorance, incompetence, and malevolence. Mumia started experiencing the fundamental problem he's living with. Other things have developed partly through the incompetence and the negligence. So, oh, thank you. If I wander away and you can't hear me, please let me know. The fundamental problem he's been dealing with for months, for over a year now, since about May of 2014, is this horrendous skin problem, which has at one point turned his skin from his medium brown colored skin to black. Several of us looking at it thought that he looked like he had been radiated. This is before we heard this whole analysis of the HEP-C treatment and the seriousness, what HEP-C can really cause. But still, we never take that of our consciousness. We never forget what this government did with Don Pedro Albizu Campos and radiated him to death. So we know that that's possible, and we can't ignore that, which is one of the reasons that even if they gave Mumia the drugs he needed, we want him out, because one, he's innocent, and two, they're going to figure out another way to try to kill him. So when Mumia first experienced this terrible itching, he didn't say anything to anybody about it, never complained to us, as far as I know, family, friends, supporters, but he eventually went to the infirmary. They gave him some kind of cream. It helped him for a while. It came back. It never really helped him. It got worse and worse, and by the summer, he began to find it more and more intolerable, and by the beginning of 2015, this year, he began telling us, this is horrendous. I can't live with this. And at that point, the rash of his skin had covered his entire body, his legs, his arms. His legs were swollen. He had lost somewhere over 50, maybe even 70 pounds, and he looked really bad. For those of us who've seen him for many years, it was shocking. Each time we saw him, he looked worse. And he said he hardly was able to sleep at that time because the itching was so bad. He found himself waking up and scratching his skin to the point of bleeding. And his skin was really oozing. So this is not a minor itching. itching really understates the severity of the problem, and the fact that the prison system took it so lightly and just gave him casually this drug, that drug, which in fact may have contributed to his development, as many of you know. And by the way, this is being live streamed, so I'm trying to repeat some of this so that audiences around the world know the background. Many of you are familiar with this, so forgive my repetition if you've heard it before. By February, I received a letter from him that I will never forget till the day I die, because it's like somebody writing a letter on his deathbed, describing what's happening to him and thinking that they may be trying to kill him, and we should have a record of what happened. So he described going to the infirmary, what they gave him, what they did, how sick he was, and so on and so on. This was sometime in February of this year. That was scary. He finally went to the infirmary when he was sick, and the infirmary took blood tests, and these so-called doctors, and I can't help but always think of the Nazi doctors and what their job was. I'm a child of World War II, and I never forget the Mengele's and his associates. So when I hear what the doctors did with the smiling faces to Mumia, they did not tell him that his blood sugar had gone way up high. He had no idea that he had developed diabetes, probably through the steroids and so on that he had been given, though now there's a theory that it's also related to the HEP-C. Dr. Harris talks about that. I'll mention that later. So on March 30th, he collapsed, and his blood sugar was very high in the 500s and was rushed to a hospital where they gave him insulin and treated him for the diabetes. They sent him home. They sent him back to the prison 2 days later into general population. 2 days later, after he nearly died. This man was so sick he made no sense. He couldn't talk. He couldn't walk. They put him back in the general prison population. And for the first time, he knew he had diabetes. And he was given insulin, and he was given a supposedly modified diet, not very impressive, and then got sick all over again. There he was, back in general population, not getting treatment. And soon enough, he was brought back, rushed again to, on March 31st, less than a month later, he was rushed back to a different hospital, a much better one, that really did extensive tests, and because there was pressure on them. By this time, let me say, we were not silent. We were not silent. The day after he collapsed, we had a press conference up at the hospital where he was. His family was there, several of his supporters were there, and there was a press conference which actually got some local coverage. We had demonstrations at the Department of Corrections. We had demonstrations at Mahanoy Prison. We even went to the governor's mansion, rotunda, and his home in Harrisburg. They did not stop getting phone calls from all over the world, non-stop phone calls. They complained to us. At one point, when they had this tough security around Mumia, where he couldn't see anybody, I think, when he was so sick, somebody I think the lawyers may have said it, or somebody told me that calling the Department of Corrections, said, "Why do you need this level of security?" They said, "Well, these people even went to the governor's office." As though it was something outrageous that we went to exercise our rights to protest an injustice. All this time, there has been no diagnosis by the Department of Corrections. This is the outrage. No diagnosis. They treat symptom after symptom, then go through the motions of all these tests, but no diagnosis of. They said it was eczema and psoriasis. Now, eczema and psoriasis, rarely has this level of symptomatology. Rarely. It became obvious that we would never get any sensible treatment plan from the Department of Corrections. And of course we were demanding that he be released to us. We were demanding that our own doctors of Mumia's choosing, be allowed to see him and treat him. They refused that. Mumia Jamal, Mumia's wife, finally said one day, "They're killing my husband. Somebody, some doctor, go and see him." So we asked Joseph Harris to see him in the visiting room. He was not able to see him privately, as a physician is supposed to get that right, but he saw him in the visiting room, and that was really the breakthrough. And that shows if you have competent medical care, this could have been dealt with way, way earlier and did not have to come to this point unless they really wanted to kill Mumia. I can't say it more politely than that. When Joseph Harris went to see him, he found the following. He was crystal clear. It was such a relief to have a doctor see him and actually put forward a theory, a diagnosis, and a treatment plan. It was the first one we had seen. They were going to do 8,000 more tests that meant nothing, and just to, appease us, but that was not going to address the real problem. So this is what Dr. Harris found at the time. He said, all of the symptoms being experienced by Mr. Abu-Jamal are highly likely to be manifestations of the active, untreated hepatitis C infection. All indications are that Mumia got this infection when he was shot, when he was arrested in 1981 at the time of the crime scene. He was nearly killed then, as you'll recall. He nearly died then. When he got the blood transfusions that he needed, he probably contracted this. So he's had this virus for a long time. And it was picked up by the prison authorities in 2012 when he was, they probably knew before, but Mumia found out about it when he was transferred from death row to general population, and they did all these tests, and he saw the results. God forbid anybody should have investigated this or checked this further, whether in the prison itself or with all this testing that they were doing. Finally, our doctors, lawyers, were pushing for the hepatitis C workup, and they found that he did have an active virus. Now, the prison is saying that it's not that high a viral load that he has, but that is so much BS, because anybody who knows anything, and they obviously don't or choose not to, knows that viral load is not the only measure of the extent and sickness of a hepatitis C. So in this case, Dr. Harris thought that this was the skin disease that he showed was particularly likely to be something called necrolytic acral erythema. And though it's a relatively rare disorder, it typically involves black patients with a skin rash like Mumia's, and that responds very minimally to the usual treatments for skin problem. It is a skin reflection of the hepatitis C. And this was Joe Harris's assessment. To give proper tribute to Joe and how brilliant his assessment was, without even being able to see Mumia in a private circumstance, he immediately did the research in other countries as well. Being a black doctor who had a history with Doctors Without Borders, he did not limit himself to research in this country, and he found that there had been black Egyptians, men, who had very, very similar pattern to Mumia's. A major breakthrough. Finally, a real theory, a major, major breakthrough. He then also said that the other symptoms that Mumia was experiencing would probably be cured if he were given this new miracle drug that some of us in this room are actually taking. You'll hear from Kamau in a minute, who's taken it, has completed a whole treatment plan, an antiviral medication that's over 90% effective and is really a major breakthrough in the treatment of hepatitis C, because the previous treatments were quite inadequate, very painful, and not very effective. Dr. Harris further said that the skin condition would be alleviated but not cured if Mumia were given zinc and prototopic cream. Now, for those who think that this is only a question of money, let me say very clearly that zinc you can buy in the drugstore for about $5. The prototopic cream is not expensive. They have refused to give Mumia this treatment that would relieve his discomfort. They had refused to give it to him. So if they're so concerned about money, why not say, okay, we'll give him this? That is an indication of the agenda not being just about money. And as much as we live in a capitalist society, we should also always remember that we also live in a fascist society. His conclusion is that, anticipating what the Department of Corrections would say, he's not a top priority because he doesn't have a high viral load, and so on and so on. Dr. Harris says, Mumia Abu-Jamal is experiencing extrahepatic symptoms, things outside of the liver. His symptoms are not restricted, even though the cause is from the liver, the symptoms are not restricted to the liver. Symptoms caused by hepatitis C. He falls within the highest priority of persons that should be treated with this new antiviral medication because of the possibility of treating all these other symptoms. In other words, his problems are much more diverse in a negative way and extensive. Finally, he says something I think that most of us know, that chronic hepatitis C are serious long-term illnesses that can last throughout a person's life. Hepatitis C is the leading cause of cirrhosis and liver cancer and is the most common cause of liver transplants. Chronic hepatitis C infection can manifest itself outside the liver, which these doctors in the DOC, excuse me again, doctors in quotes, and skin rashes, eczema, often accompanied by severe and painful itching, are not uncommon. Mumia also had anemia, which Dr. Harris also says can be related to the hepatitis C, and the diabetes that he developed, which we thought came partly from the steroids, he's saying could have definitely been related to the hepatitis C as well. As soon as we had that in writing, our battle moved. Demand that treatment now. And that's what we're in the middle of today, and that's what today is about. And you know what? We're going to win.
That's right.
Thank you, Suzanne. The next speaker is a very good friend of mine. He's a fellow activist in Philadelphia, and his name is Kamal Bektemba. He's speaking because he just went through the whole treatment for Hep-C and is completely cured now, and he wants to talk about how that happened.
I just got finished taking the medicine, and I'm supposed to be completely cured according to all the tests that's been given to me. I first contacted this disease back in, I believe, 1962, when I came home from prison. You know, I was coming up, I was very inquisitive, experimenting with alcohol, experimenting with drugs, you know, just to, I ain't really know much about it, but I was experimenting. And that's how I believe I contacted it. One day, back in 62, I went to get some blood. I tried to give some blood, because when you get blood, they would give you like $15 or $20 or whatever. And I was trying to get some wine money together at the time. So, but they told me, they rejected it, and they told me that there was something wrong with my blood. So I believe that's when I first contacted it, experimenting with taking heroin with a couple of friends that I knew at the time. I wasn't really treated for it. I didn't know, they didn't tell me what it was at that time. So I found out back in 2000 through my wife's doctor. He told me that I had hepatitis C. And so at that time they was telling me that they wanted to treat me then, but I didn't want to be treated because of the side effects. They say, you know, you'll be tired and different things, and I'm working at the time. I said, well, I can't work if it's going to take all my energy away from me. You know, so I rejected it, you know, based on the side effects. But then they came out with this new medicine. The doctors told me about it, and they thought I'd be a good candidate to take it. So I did it, and so you got to take the pills for 3 months. I did that, and I'm cured.
Wow.
You know, so.
Of course, this press conference is primarily devoted to Mumia Abu-Jamal and to the prisoners in Pennsylvania. But it's really important to notice that there are other political prisoners in this country who have serious illnesses and who need the same kind of struggle and push to change their lives so that they will still be with us and still be a part of the struggle. It took me quite a while to try to find some information about our political prisoner, Jamil Al-Amin, formerly known as H. Rap Brown. But I did find a website that has a lot of information about him, so I wanted to share that with you. The name of the website is Imam, I-M-A-M, Jamil something something. We know that he has serious health problems, and we need to do everything that we can to help support the movement and build the movement to get him the medical care that he needs. If Pam has some more information about it.
You can get information about Imam Jamil Al-Amin from the Jericho website, and that has information on all the political prisoners. Right now, he's sort of stable, and he had a swelling in his neck and his face and his throat. At this particular point, I talked with his wife just before I went to California, and she said that things is beginning to look a little better. But I'm glad that I got a chance to come to say something again. I was on the outside, and 1199 SEIU, right, has a thing for caregivers demand clean air, water, and energy, and that's what's needed inside the prison as well on the outside. So, I want to hand it to all the unions and all for stepping up, about it. The conditions inside the prisons with water. There's a lot of fracking going on in Pennsylvania. It affects the water there. Caregivers, prisoners, the hospitals are supposed to be caregivers, and I, along with them, and I had to bring this up, caregivers demand clean air, water, and energy. Caregivers demand this inside the prisons as well. In fact, they don't make a limit to what they're talking about. For detailed information on Brother Jamil Al-Amin and how you can help him, go to the Jericho website.
I'd like to raise another prisoner, a political prisoner, who happens to have the same birthday as me, September 12th, Leonard Peltier. And here to speak about him is Maggie Tobin.
Leonard Peltier is a 71-year-old Native American political prisoner. He has struggled with health problems ever since his incarceration almost 40 years ago. For example, Leonard had a congenital jaw problem, and it got worse and worse and worse, and the prison refused to treat it. Finally, in 1995, it was so badly treated at a medical facility in the prison system that Leonard almost died. He had to have numerous blood transfusions to save his life. It was eventually corrected in 2000, but for years he was tortured. It was almost impossible to eat. He's had numerous other problems, but one of his biggest problems now is diabetes. And we know that from Mumia's case, it can almost kill you if it's left untreated. And Leonard's blood sugar is extremely unstable. It's very hard to control. Sometimes when prisoners are in solitary confinement, they are deprived of their life-saving medicines. And another problem is lockdown. When people are not treated right, they don't get the right food. Recently, USP1 Coleman in Coleman, Florida, where Leonard is currently incarcerated, they had a lockdown. And the prisoners received one warm meal a day and bread and water for the other 2 meals. This was almost for 3 weeks, and Leonard's blood sugar absolutely skyrocketed as a result. Now, we all know what can happen with diabetes: blindness, kidney failure, amputation of your lower limbs. Leonard has a heart condition, and that's a very serious problem for anybody with diabetes. We know that the U.S. prison system is brutal and very vindictive, and that depriving prisoners of medications and medical care is one aspect of that. We must keep up the fight, as we are here today, to make sure that prisons everywhere provide the necessary medical care for one of our most vulnerable populations. They are counting on us. Thank you.
Our next speaker is Ori Lumumba, who will give us an update about, first, the medical neglect in the prison and the eventual HEP-C treatment of New York City political prisoner Robert Seth Hayes.
The issue of medical neglect inside of prisons, especially as it relates to our political prisoners, is nothing new. For the resiliency that some of our freedom fighters have shown all these years being in prison, this government has furthered its attempts to kill people in prison. In New York State, we've lost 4 political prisoners due to medical neglect. Albert Noah Washington through cancer, Bashir Hamid through cancer, Teddy Jaheed through cancer, Kawazi Balgoon through age-related symptoms. Men that could have been home if the governor would have released them with compassionate release, but didn't, left them there to die. Years of an unhealthy diet, of no fresh air, no exercise, culminated into health problems that finally killed these 4 men in New York State prisons. And the situation now with Robert Seth Hayes is no different. Robert Seth Hayes has been in New York State prison since 1973 for his actions in the Black Panther Party. In 1998, Robert Seth Hayes was diagnosed with diabetes. In 2000, he was diagnosed with hepatitis C. For a 15-year period, from 2000 to 2015, Robert Seth Hayes' hepatitis C ran rampant. 15 years later, after being diagnosed with it, just this past month or last month, it was finally treated due to the pressure and the demands of the public. We finally got the necessary treatment needed for Robert Seth Hayes to cure him of this hepatitis C. But the fight's not over. Robert Seth Hayes' blood sugar levels has been out of control. We almost lost Seth last Thursday. He went into a cold blue where his blood sugars decreased. They decreased rapidly, and we almost lost him. You know, right now, he's taking an inhaler 2 times a week. Prison officials have given him a nebulizer. He can't even cough the phlegm out of his chest. He went from 200 pounds to 178 pounds to now 130 pounds. He has lesions on his chest that's still being untreated. He's wheezing. He doesn't have an appetite. You know, and the appeal Seth made is, we have to step this up and get me out of here, because I feel like I don't have long and I'm going to be left to die in here. Okay, so this is a serious message and a serious warning. And what we have to do is step our efforts up on this issue. Like I said, some of our freedom, they can't break. They can't break. And they're trying to speed up the process with them dying in prison through medical neglect. What this government, what the Philadelphia police failed to do in 1981, and what this government failed to do in 95 and 99, prison officials in Pennsylvania are trying to do, and that's murder Mumia. The same forces that's trying to murder Mumia is trying to murder Robert Seth Hayes, just like they did Richard Williams in California federal prisons through medical neglect. And for more information, people can go to jerichony.org and get more information on how you can help Robert Seth Hayes. But at this point, your help is needed. It is no reason why it took 15 years to get the proper hepatitis C treatment for this man. These prison officials are playing games, and we can't allow them to play games. We have to constantly be in their face, putting pressure on them on this issue of Mumia, of Seth, of Leonard, of all our freedom fighters, not just our freedom fighters, but all the men and women in the United States prison system suffering on this issue. You know, our sister Safia Bakari, the late Safia Bakari, touched on this issue in 2000 of the growing hepatitis C population in the prison systems, and it's skyrocketed. You know, so just want to close. Again, you can go to jerichony.org and get more information on Seth Hayes and everything, and we just want to say free them all, on the move.
Thank you, Ori. HEP-C is an epidemic not just in the prisons, but also out here on the streets. New York City has a HEP-C task force made up of maybe 20 different groups in the city trying to deal with this epidemic. Among those groups is the After Hours Project, and to speak from that organization today is Baron Graham.
I'm with a harm reduction program called the After Hours Project. We work with doing testing for HEP-C, HIV, and we also are a syringe exchange program. But what makes us unique is that we work in the evening hours. We work from the hours of 5 to 10. We began testing for HEP-C over a year and a half ago. We've been getting a high percentage rate up on people coming back positive. Fortunately, we're able to work with a doctor in our area who's been able to work with these people in receiving treatment. At first, it was a little difficult due to the fact that the price tag of the medication and how much it cost. We began to advocate for these clients, and we were able to get them the medication that they needed. Needless to say that there's still more work to be done out there, because we're a coalition of different programs who basically try to assist these clients in getting medication, but there's hundreds of people out there who are affected and they may not even know, because this disease is a silent killer. You may be affected today, may not know. 20 years down the line, you wake up, you got liver cancer, cirrhosis of the liver, and you don't know why. And then when you be tested, you find out you have HEP-C. So we continue to be out there on a day-to-day basis to deal with clients who basically are underserved. They don't have any means of income and things of that nature. So we basically walk them through the process in order for them to get the medication that they need. More is needed, not only in this state, in every state. The problem is that, or from my perspective, is that people don't look at medical situations, they look at a price tag. They put a price tag on a life. We're humans, we shouldn't do that. We need to rectify when someone comes in and they're in need of assistance, we need to assist them. So I'm going to continue to be out there and keep the door of hope open for as many people as I can. Thank you.
I'd like to introduce Bob Boyle, who's an attorney on Mumia's legal team with a long history of defending and winning the release of political prisoners.
Great to be here and to give this update on the legal situation, recognizing also that everything is political and that the political struggle is in many ways more important than the legal struggle, and without the people demanding treatment for Mumia and everyone else, it's not going to happen. One of the reasons is the state of the law on medical care in prisons is atrocious. It's atrocious. The Eighth Amendment says prisoners have a right to medical care. But basically that's been eviscerated through a series of Supreme Court decisions where you have to prove deliberate indifference. Not just they're not doing enough, you have to show basically they're doing nothing to prevail on an Eighth Amendment claim. And that is what we're up against in the courts, which I want to impress upon people makes it even more important to keep the political struggle up. Because the Department of Corrections of Pennsylvania's position is, well, even though there's this drug that can cure Mumia and the 10,000 other prisoners in Pennsylvania who probably have active hepatitis C infections, we're doing what we can do. We're monitoring him. We're testing his liver functions. We're giving him a cream now and then when the skin condition gets really bad and it's alleviated a little bit. So we're doing something, and in federal court you have to prove, well, they're doing nothing in order to get an Eighth Amendment violation. So, and I analogize it to, as Suzanne was talking about it, remember the early days, before 97 and the HIV cocktail. Yeah. People would get sick with the opportunistic infections and get treatment for those infections as they would arise. In other words, they treat things as they pop up. But the HIV was still running rampant. So what they're doing with the hepatitis C is similar in the state of Pennsylvania. They're saying it's okay if we just cure, or not cure, treat these symptoms when they get bad enough, but knowing that they have a drug that can actually cure the disease and stop those symptoms. So it's not just medical neglect, as the poster says. What the state of Pennsylvania is doing is intentional. They're intentionally not giving Mumia and the other 10,000 people this drug. And they'll never say that it's money. One thing that's true in the jurisprudence of Eighth Amendment is that expense cannot be an excuse. You cannot deny medical care on the basis of expense. So their position is, well, we're doing what we can, and we're doing enough under the Constitution. Currently, what's happened is that we did file a motion for an injunction back in August with some of the papers that Suzanne was reading, demanding that the state of Pennsylvania treat Mumia. A few weeks ago, a magistrate judge to whom the motion was referred wrote a recommendation that our motion be denied. That was appealed to the district court judge, who is now considering our appeal of that denial. And basically, the magistrate judge says, well, he's being monitored and they're giving him, some stuff, so that's sufficient under the Eighth Amendment. We're hoping that this district court judge will take another approach, or that we will at least be able to get into court to argue and have a hearing about what's necessary. And finally, in closing, I think, it applies to Mumia, but also to everyone else. Hepatitis C is an infectious disease. And people who get out of prison, and most people, and we hope Mumia very soon, do get out of prison, they're going back into the community. And so it's a public health crisis. So that everyone in prison should get treated, everyone everywhere should get treated, but because it's a public health issue, because more and more people can attract that virus, and more people can get sick, and there's going to be more and more money spent. Keep up the struggle, free Mumia and all political prisoners.
Our next speaker is Dr. Melissa Barber. She's affiliated with the Interreligious Foundation for Community Organization, IFCO, Pastors for Peace, and she just graduated from the Latin American School of Medicine in Havana, Cuba. We've heard about the situation here in infectious diseases. She's going to speak on Cuba's approach.
I wish I can say that I just graduated, but I graduated over 7-8 years ago from the Latin American School of Medicine. And I actually now run and facilitate the project here through IFCO Pastors for Peace. So I have the proud job of sending students of color to Cuba for free to train and become medical physicians. And I'm always very proud of that, because when we hear about situations like this and we want, Mumia to be freed, and we talk about the political prisoners that need our care, medical care, and that are medically neglected, as well as the population at large. I know that the students that I'm sending over to Cuba are actually doing big things and becoming revolutionary doctors to come back and infiltrate the system and do great things. So that makes me very proud. And I kind of wondered, what am I going to say? How am I going to start my talk? And I just want to say that just thinking on what to say, it brought me back to a moment, not last year, where I had a young student from California, and he had run into the law, and he, was a juvenile, what they call juvenile delinquents. He was able to turn his life around. And as part of turning his life around, he was like, I want to be a doctor. I know it's my purpose to be a doctor. Some of us, we look at our past experiences and we try to run from those things and kind of hide them and put them in the back and say, that was the secretive part that I don't want anybody to know about. And I looked him dead in his eyes and I said, do you know the reason why you went through what you went through is not just for you, it's for everybody coming behind you, and it's for the people who need you. I said, so when you get that diploma and you become a medical physician and you know what that prison system is like as a juvenile sitting in that prison system, you can come back and begin to be a doctor in that system, and with the level of care and nurturing that you've been trained and ingrained to have to treat patients differently than the model that you've seen here in the U.S., you can come back and you can treat the prisoners in that system. And you can tell them where you come from and be proud that, yeah, you were in that and your life changed. And as a result of that experience, the compassion that you have now, you can actually go back and treat the people who you once were. And so that makes me proud to know that I'm a part of a system where not only was I trained differently, to not see a patient as a dollar bill, but to see a patient as humane and a person. One of the reasons why I feel that I'm here and to talk about the system and how Cuba handles the system is, first we have to talk about the model of healthcare just being a preventive type model. So you have a system where screenings are done. Everybody has access to free healthcare. So you're never running into a situation where somebody doesn't know what they have and that there's a condition that's allowed to escalate to the level at which Mumia had to suffer through because there was nobody checking and doing regular checkups to make sure that that wasn't the case. Right? And we're not in a system where mothers and children are not given access to health care, so our babies are growing up healthy. And we don't have all of these access conditions and diseases that are going on that go unchecked. Part of just talking about the Cuban model and the level of prevention that takes place and the level of the model being a family practice or community-based medicine and social-based medicine is that we have a doctor for, within a 10-block radius for all of the patients that belong in that block. So you have one doctor for about 125 patients, if that. And a nurse to treat that same patient, and a doctor and a nurse living in the community and sometimes in the apartment complex as the families that they're treating. So you have access at all times to a primary care, a first class, first level based. If, there's something wrong, I can go and knock on my doctor's door and say, this is what's going on, and he can come and assist me. And after that level of care, if it gets out of hand, I can have a polyclinic that can do all of the laboratory work and all of the necessary stuff at that second tier to say, here's a specialist that you need, and you can go access that specialist when you need to access them on an everyday basis. Right? And then if it escalates, you can go to a hospital and this patient, is referred to that polyclinic. We need you to go to the hospital because now this condition is a little, is untreated and you need a little bit more care than we can give you at this level. So we refer you to the hospital and you go to the hospital and you're taken care of there. And while you're in, you don't have to worry about not, working, and you don't have to worry about insurance, and you don't have to worry about whether you'll have access to that medication because you can't afford it, because everybody is getting access to medication and it's free of charge. And if it's not free of charge, guess what? I can go and get a medicine like an aspirin or anything else that I need for about the equivalent of a quarter. So I don't even have to pay for medicines and worry about paying for medicines and being exhausted to the point that I can't have access to medicine because I can't afford it. That's just not something that you see in Cuba. As I was studying in Cuba and as I was practicing medicine in Cuba, when there was a prisoner who needed help, they would come directly and be brought directly to the hospital. And no, they didn't have cracked jaws when they came, and no, they weren't scuffed up and beat up, while they were taken to the hospital, but they were treated humanly, human beings getting treated humanely by physicians that can see them when they needed health care. So this is an alternative to what we see here. And we know that it can be done because it's being done on a daily basis, right? from a country with little resources. In 2009, when they started the peg-heberon, which is the hepatitis C vaccine that they have, that was open and free to everyone in the population since 2010. Since 2010. Everybody has access to this medication, and they have a demand for more production of that hepatitis C vaccine so that everybody who has chronic hepatitis can have access to it. So we're looking at an alternative system that's showing us, with the little resources that they have, that it's possible. It's possible to treat every single person that has hepatitis C on a chronic level. Money shouldn't be the issue, because everybody is having access to that hepatitis C vaccine. It started in Havana in 3 hospitals where they were giving it in conjunction. You know, that the interferon that they have, which was a component of the interferon 2B, 2A with the gamma, a direct acting protease inhibitor. So they were in conjunction given that medication and finding out that it was 27% more efficient than the conventional treatments that they were giving patients. So it became one of the medicines that was registered in the 888 medicines that were a part of the profile to be added to Cuba's registry of medicines that everybody would have access to. So if we can do it in a country like Cuba, why are we not doing it here? As he said, you want to put a dollar on whose life is expendable and who's worth it. But human life is always worth it. So we should never have any issues with treating patients who need care. Even prisoners have, a right to have access to care. So why are they being neglected? I, have family members who were incarcerated, and we had to struggle and fight that same fight. My uncle with, hyperthyroidism almost lost his life in prison because the doctors were not treating him and giving him the proper access to care that he needed. And it was a fight and is a struggle. So it's across the board where people are being neglected. And as he said, they're coming back into this population. And so we need to provide means, and we need healthcare professionals that are actually equipped to actually treat these patients and not see the insurance and not say, oh, because they don't have insurance, we're not going to treat them. Because they're going to be a public health issue, and this is going to be a public health crisis. If you're out there and you're looking at this live stream and you're a healthcare professional, you're a public health, advocate, a policy maker, you need to understand that life is valuable and it's always worth it. And at the end of the day, why pay more to actually treat a disease if you can prevent it? Why? Right. It makes absolutely no sense. It's being done. Whole populations, Cuba, the whole nation, they do vaccination campaigns. They have national weeks where they treat, and do, vaccination campaigns throughout the island. And they've managed to vaccinate all of their people. And they've managed to give treatments to everybody, especially if they have access to those treatments. So the embargo is still screwing things up where they don't get access to a lot of things that they need. But the biotech companies are doing great jobs doing the research and the development that they need for these medications. And so part of it, if we want our populations to have access to medicines, we need to begin to break down barriers and tell the government also, cut out this blockade. Get rid of this embargo, because this treatment that is being given to these patients for free, we need that. So we need to open up the doors and learn, because not only are they doing the hepatitis C and the lung cancer vaccines and the diabetic ulcer, medications, they have a whole bunch of medications at free and low cost that we need as a society. So as we begin to break down these barriers, money will no longer be the issue. And people can't complain and say, oh, we don't have access to that, or these people can't be given access to that, because it's affordable. It's affordable. And we have means in which to get it. So we need to begin to fight and knock down the barriers of that blockade so that our people can get access to those medications that are open and free and cost effective to treat them. So think about that. And if you're out there and you're a medical professional, you know, you're specialized and you're doing a lot because you have loans and you have this, but there are educations that are free. We have this program where we're training doctors to go to Cuba to have free medical education. And they're coming back and they're, you know, made that commitment to actually work in underserved communities. So if, you know, cost is a barrier to medical school, begin to think about the Latin American School of Medicine so that you can come home and give back to communities such as these that need you, you know? And if you're out there, begin to, you know, put in the fight. All of these political prisoners need care. We need to be treating them. We need to be treating them. We can't ignore the fact. If you ignore your neighbor and your brother, how long is it going to be before something knocks on your door and you need help? We are our brother's keepers. We are our sister's keepers, and we need to remember that always.
Thank you, Dr. Barber. That was a wonderful way to end this. Such an inspiring talk about what is possible in another world that we in this country are still in the process of fighting for.